In this video we will learn following things about diabetes: causes of type 2 diabetes, diagnosis, goals of therapy, pharmacological therapy, hyperglycemin emergencies, HOVR-DKA and HHS treated, diabetic ketoacidosis. Causes of type 2 diabetes: cancer, chronic pancreatitis, pheochromocytoma, acromegaly, Cushing's syndrome, thyrotoxicosis, malnutrition, dysglycemia-inducing conditions, for example infection. Drug-induced causes: glucocorticoids, atypical antipsychotics, protease inhibitors, quercetin inhibitors, tacrolimus, cyclosporin, niacin, dysglycemia-inducing agents, thiazide diuretics, BB, CCB, phenytoin. Diagnosis: fasting glucose test is defined as testing glucose levels when there is no caloric intake for at least 8 hours. Random glucose test is defined as testing glucose levels any time of the day without regards to last meal. Postprandial means after a meal. Therefore, ppg concentrations refer to plasma glucose concentrations after eating. Diagnosis: FPG more than or equal to 7.0 mol, random plasma glucose more than or equal to 11.1 mol, 2-HPG in 75 gram OGTT more than or equal to 11.1 mol, A1C more than or equal to 6.5%. FPG stands for fasting plasma glucose. 2-HPG stands for 2-hour postprandial glucose testing. OGTT stands for oral glucose tolerance test. A1C stands for average sugar eating over last few months. Goals of therapy: reduce occurrence of hypoglycemia, prevent macrovascular and microvascular complications, achieve HbA1c target within 3-6 months of diagnosis, educate patient regarding the benefits of controlling blood sugar levels and non-pharm management. Pharmacological therapy: alpha-glucosidase inhibitors example is acarbose, biguanides example is metformin, dipeptidyl peptidase 4 inhibitors DPP4 as examples are alogliptin, linagliptin, saxagliptin, sitagliptin, glucagon-like peptide 1, GLP-1, agonists examples are dulaglutide, exenatide, liraglutide, lexasenatide, semaglutide. Pharmacological therapy: insulin secretagogue, sulfonylureas examples are gliclazide, glimepiride, gliburide, insulin secretagogue. Meglitinides examples are repaglinide, sodium glucose cotransporter 2, SGLT2 inhibitors examples are canagliflozin, dapagliflozin, empagliflozin, erchagliflozin, thiazolidinedians. TZDs examples are pioglitazone, rosiglitazone. Weight loss agent examples are orlistat. Hyperglycemic emergencies: suspect DKA and HHS in ill patients presenting with hyperglycemia, DKA, diabetic ketoacidosis, HHS, hyperosmolar hyperglycemia state. DKA, diabetic ketoacidosis. Ketoacidosis ketones can be detected in urine and blood. Extracellular fluid volume contraction, volume depletion, milder hyperosmolarity, elevated glucose levels, may have reduced consciousness, possible hypokalemia, must use insulin, absolute insulin deficiency plus increased glucagon. Hyperosmolar hyperglycemic state HHS, acid-base problem is minimal, extracellular fluid volume contraction, hyperosmolarity, significant hyperglycemia, may have significant loss of consciousness, possible hypokalemia, may require insulin, relative insulin deficiency. HOVR-DKA and HHS treated, fluids, IV normal saline fluid replacement, potassium don't give KCl unless urine is being produced, insulin, bicarbonate, infrequently used, lab tests. Look for possible trigger like infections. Learn terminologies with MJM.